Hey everyone, welcome to Going Long. I'm Craig Lewin, Beyond the Breakers Open Water Swim Summit founder. And in this series, we talk to Beyond the Breakers speakers, past and present, to get to know them a little better. And today I'm speaking with Dr. Alex Ewart, Doctor of Physical Therapy, former D1 swimmer, and team captain at Boston University. He's an Ironman finisher and the founder of Lane 4 PT at L4PT.com and the Swimming PT at theswimmingpt.com. He's built one of the only PT practices designed from the ground up for swimmers and endurance athletes. His own injury story is what drove him here, and it's a story a lot of people in this community are going to recognize immediately. So let's get into it. Alex, welcome.
Yeah, I'm excited to be here.
Cool. So let's jump into our first question. I've been asking all of our speakers on the Going Long series. Give us quick 30-second elevator pitch, who you are, what you do, what's your connection to swimming, so we all get to know you a little bit better.
Yeah, so I'm Alex Ewart. I'm a doctor of physical therapy. Been a lifelong swimmer, super passionate about it, and I basically help swimmers get out of pain and improve their performance. And it's what I do every day, and it's what I love to do.
Amazing. That's perfect. So let's dive in. You were what, Division 1 butterflyer for BU, correct?
Correct.
You were the captain of the team one of your
Yeah.
senior year, I'm assuming.
hmm
Um, and then you had an injury, and I think that's what led you to physical therapy. So can you fill in the gaps? Because that was not a great story. So fill in the gaps on how you went
Yeah.
from swimmer to PT.
Yeah, so it's not an injury in like the most classic sense. So I had a really good freshman year. You could say like a breakout year in some ways. And so I had a really good year. I went home for the summer and I was training with a local team, with a local college team back here in Maryland that allowed like other college athletes to come train with them. And so I was kind of grinding away all summer and I started to notice that my right arm was just a little pinchy, but also it was just like weaker. And particularly in fly, like I noticed that I just couldn't pull the water, right? And everything just felt like a lot more labored. And so I didn't, again, you're 19 at the time, right? You don't really, not much is going through your brain. So you're just kind of pushing right through it, right? And I didn't think anything of it. And it wasn't until I get back to school as a sophomore, right? Super pumped. And like, long story short, right? Like my first, which was my best event, 200 fly, like that first event of the year, right? It was crap, right? It was terrible. Like I don't even remember how much time I added, but it was the slowest time I'd gone in like a very, very long time. And that's when I kind of knew that something was off. And so at that point, right, I knew some things had to kind of change. So I started working with the trainers, right, and doing some stuff, and it gets a little bit better throughout the season, but not too much, right? And I end up having like the worst season that I swam, right, by far. And so then I come home for this summer and it's it's still not better. And so my mom at that point was like, well, we should do something more about this, right? Like doing nothing's not going to change anything. And so that's when she suggested I see, it was my neighbor at the time who was a PT with a really solid reputation. And so she's like, maybe you should go see her. And I was like, I don't know. Right. And that's where, obviously went to go see her. Right. And it was mind blowing. Right. The whole experience was amazing. And it was very individualized, customized, very focused to me. And so from there, I was making a lot of improvements, right? And everything was kind of getting back into a rhythm. And then it was time for me to go back to school. And so I went back to school, and it's just a completely different ball game, right? When you're working with me in like athletic training room. And I feel like I lost a little bit of that individualized attention, right? That customized, and I backslid, right? I went backwards. And so from there is like my fly got better, but not really that much better. And I ended up switching like entirely to more like the distance swimming and the mile because of that. And so it's that of knowing like what the attention I was getting, right? The attention to detail, and then kind of sliding backwards is kind of the why I have in motivating me to kind of pursue more professionally, but also help swimmers, all over.
It's a very, very interesting story. I think obviously I swam in college as well, and I did not have the same experience. I think I got injured all the time and was the dumb 19-year-old not thinking a lot and just tried to tough it out. And now I get to suffer the consequences that daily. But yeah, that's a pretty amazing story. So, you got frustrated like with just getting that generic care. You personally have now pivoted more towards being a physical therapist who specializes in swimmers. Is there like a major difference between what you do versus, people who don't focus on swimmers or more of like I guess a general practitioner of sorts?
I think there are differences, right? And sometimes they're subtle, but I think they make a big difference, right? And so I think there's a couple things, right? So one, if you got to think about like what you're doing in the water, right? And from a training perspective, but also from like a stroke mechanics type perspective. And so like especially right if you're more of like a master's long distance open water, right? There's things you just got to think about in terms of training that you should modify, and then also what you're doing with technique in the pool. And if you can do all the right exercise in some cases, but if you keep going, if you're not structuring your long swims accordingly, right, or you keep making the same stroke errors in the pool, like none of it's going to work as well. And so I think from like the swim side, right, there's that piece that can be extremely helpful. And then second is like you have to think about it's just the knowledge of okay, like maybe your rotator cuff is the problem, right? But like if you really think about when you're feeling it in your stroke, right? It might not actually be the rotator cuff, might be the thing that's painful, but it might not be the problem,
Mhm.
right? That's driving the rotator cuff to become painful. And that's like putting like, okay, these muscles are active during this part of the stroke, right? And if you don't think about that, you might kind of entirely miss like what movement pattern or what area is actually the issue. So there's like little subtle things like that where I think having the background of the sport is just, I mean, it's just critical, right? And I think too, it's just a level of trust and bonding that it's hard to build elsewhere, right? It's just having comfort and knowing that someone completely understands your situation is also key.
Do you find that you're telling stories about your swimming when you're trying to relate to like current patients of yours, like trying to connect the dots and give them some anecdotal references that they might be able to remember, or do you try to lay off that and just focus more on more on the issues they're having and try to educate them better about how to understand the difference between like where it's hurting versus what's actually causing it?
I think you do a little bit, right? I think you do that, and I think you also share stories while keeping the person anonymous, right, of what other clients, right, or patients have gone through, and obviously keeping it HIPAA compliant. But like, I think people draw inspiration from a bunch of different things, right? So if it's a younger swimmer, right, then you kind of might tell stories of when I am younger, right? If it's a master swimmer, right, or a long distance swimmer, you might talk about, the swimmer that you worked with that's doing the 10-mile open water swim, this summer, right? Or you kind of draw from different areas, but I think as humans, right, it's like sometimes you learn more and you remember those stories and it can make a point hit harder, right? So for sure, I draw my experiences, but I also use everyone that I've worked with, right? I use their experience as well to then try and explain things to others.
So how do you, I guess, when you're talking to a swimmer, I know when I was a swimmer, same kind of thing was time in the water, getting, being there, doing the sets, not being out of the water for too long. How do you get younger swimmers to understand that, take a step back so that they can, I mean, yes, younger and older swimmers, like if you're working with marathon swimmers, how do you get them to take that step back and bring the physical therapy element into their routine to try to prevent, one, relieve the pain, but then two, prevent it from happening in the future?
Are you saying like take a step back in the
Well,
sense
in
of
their own
like,
training, right? Like when someone says, "Oh, like, oh, my shoulder hurts. I'm just gonna swim through it. It's gonna be fine." Right? Like I
yeah,
remember when I was swimming in high school, swimming in college, it was like I had to be in the water. I didn't care if I was hurt. I had to be in the water because if I wasn't in the water, I wasn't getting faster. I was losing fitness. So I wondered, do you have the same problem with today's athletes? And how do you How do you help get them over that mindset?
For sure, right? I think the first thing is I try my best, right, to have, okay, like we have them zoom out, right? And I like to ask questions and have them kind of, or anyone really come up with their own solution because it might be a little bit different from what I'm thinking. But I think it's like zooming out and talking like, okay, like if you have a race in 3 months, right? Like what is going to negatively impact you in 3 months the most, right? Is it peeling back for a little bit, right? Or is it just plowing through and you can't get any solid training in?
Mhm.
So I think it's peeling back and really looking at, okay, we want you to be at your best in whatever time period we have, right? Until the next big race and thinking, okay, that's what we're aiming for. Yes, we care about that workout tomorrow, like for sure, right? Because I get it. I'm an addict, right, of exercise. Like, but right, that's the big goal. We have to keep that goal in mind. And suffering tomorrow might not actually move you closer to where you want to be in the 3 months. Is kind of how I think about it. But I also think of like, and if someone's more of like an engineer, logical based approach, like 'cause we have studies, right, that like if you peel back for a couple days, right, it's not gonna negatively impact your fitness that much, right? But at the same time, I get it. Like, and so I try and minimize how much we're changing the routine, right? So, like, if someone's swimming, they know that they like to do 5K 4 times a week, let's say, right? We want to try and keep that as close as we can, right? Obviously, doing everything that we can to heal. But the question is, like, how can we modify it, right? How can we work around it? And so I try to go there first. And then if it is a situation where we do need to peel back, is we just try and look at the big picture and think about what are your goals and what's best serving you for those.
Yeah, that makes a lot of sense. Like thinking about your goal, is this moving you closer to it or further from it? And then adjusting accordingly. I think that makes a lot of sense. And then transitioning, so that's, just swimmers in general. Obviously, Beyond the Breakers is more geared toward open water swimmers. I think it's a different, having done, myself, yourself, like pool, open water, different distances. There's a lot of differences between the pool swimming and then when you start adding open water in. So is there like a difference in the injury profile when you look at the pool athletes that you work with versus your open water athletes? And is there something common that they're always coming to you with or mainly coming to you with?
Well, most of the time, right, it's shoulder, neck, and things like that. I think the difference is in the demands of open water swimming. You obviously have the unknown, right? Conditions are a factor. There's a little more variability. And so you kind of have to think about those things. And I think from like a mechanical side, there's always the sighting aspect, right? Because you have to pick your head up more. You have to lift your head. You have to, right? To breathe a little more. And so it's thinking about those things, right? In that it's not different mobility requirements per se, but like for the open water swimmer that has shoulder pain, it gets locked up, right? You need to think about that mid back, the lower part of your neck, right? Because that's something where you have to move through it more. And if that tightens up, that's going to then change everything else. And I think that, and then from a training side, right? It's like you have the back-to-back long swims over the weekend, depending on what you're doing, right? You have the super long swims, and it's thinking holistically too of like, all right, you have these long swims. We have to contend with that as well. There's no breaks with the walls. So thinking about the demands, but then also mechanically, it's just really the sighting, and there's a little bit more variability in terms of current waves and all that kind of stuff that you have to just take into account when you're building a program, right? Or kind of working through what you're going to do in training.
Yeah, that makes a lot of sense. How do you, I guess, when you work with these athletes, open water athletes specifically, they have to do these things. Like they have to sight. Say they have a neck injury, shoulder injury, they're feeling pain, they're doing, their longer swims. Are there certain motions that they can do differently, or is there feedback you give your athletes that allow them to still execute on the performance side, but also alleviates, some of the pain in water during the moment, obviously, supplemented with all of the work they're doing out of the water as well.
Yeah, so I think like for in terms of changing like sighting mechanics. I think one of the things is you think about like trying to keep your head more neutral, right? Or maybe not lifting your head quite as much, right? Because sometimes you might, if you think about lifting your head a little bit less high, you might think that you're going super low, like you're barely lifting, but turns out you might only be doing a little bit less, but that's enough to alleviate stress, right? And there's other like little tips and tricks like adding in maybe like if you're swimming, right, let's say you're doing like 3 hours, something along those lines. Like, every 25 minutes, right, you do like this a specific drill for 3 to 5 minutes, right? Or you kind of do something like that to then kind of back off the stress a little bit, but keeps you moving in the right direction, changing your mechanics, helping you move in the right direction, right? Because the goal is again is to perform, right? And so it's thinking, okay, what can we do in that context to keep you moving in that right direction, right? And minimizing disruptions as much as we can.
Yeah. I think when I'm swimming, I know I've had shoulder injuries over the years. I'm always like in the moment, like if I'm doing Catalina English Channel, something hurts. I'm like, all right, what can I do differently to get this pain to
Yeah.
stop so that I can get to the end of the swim? Is it technically right? Maybe, maybe not. But I think having a resource who knows, all right, try this, try that, is incredibly valuable for the athlete to get that from someone like you who's both been in the water and has the education and the experience where they trust, okay, yeah, like if he's saying this, it's probably going to work and it's not going to make things worse. So I think that's really helpful. Sometimes you get in your own head and you can't think about, you just don't even know like where to start. And then something so basic as, well, just don't tilt your head up as much. So having a resource to hear that from is incredibly helpful. And then transitioning like into the injuries themselves, is there something, is it volume related? Is it ramp related? Like, what do you think when you work with your athletes is the cause of a lot of the shoulder injuries or neck injuries that you've seen historically?
Yeah, it's a good question and it's a tough one, right? Because there's a lot. I feel like the more people research like what causes injuries, the more they don't know, right?
Mm-hmm.
And so I think oftentimes, right, you have to think of like a cup, right? And in the cup, right, if you have, let's say you're doing, for easy numbers, right, you're doing 4 swims at 5K a piece on average, right? So you have like that physical demand, right? You pour that water in the cup, that's that equivalent, right? And then let's say you have, you know, a strength session every week, right? You pour a little more water in the cup, right? And if you have, let's say you have some stuff with family going on, right? Or you have a crappy weeks of sleep, right? You pour more water in the cup, right? And if you pour too much water in, it then overfills. And so, like, I think a lot of these things occur. It's not in isolation, right? It might be you ramped up training, and that could totally be it, right? But it also could be you did your normal ramp up in training, right? But it also so happened that, right, you were sick a couple weeks prior, you pushed through training, and that's what led you to not recover. So I rarely think there's this simple thing. And because of that, it's important to think about all these things together, right? And it's kind of picking each part out. And if you don't, right, you're not fully addressing it. So I don't, it's rarely as simple as, yeah, like I did too much, right? There's a lot of other factors into play. And I think it's kind of looking holistically because for a lot of swimmers, right, you're kind of either you work your way up in distance, right? Or you've been doing these long swims for a while. And so like there's a lot of people I've worked with, right? They might not actually be swimming any more than they have in the last like 3 to 5 years. And somehow now their shoulder hurts. And you have to think like, like what's going on there, right? And it's kind of digging a little bit deeper. So that's how I think about it. And just kind of it's the reality of being dealing and working with humans, right? It's messy.
Yeah. Yeah, that's fair. I mean, you could have one technical flaw. You do it a ton of times, ramp up fast, throw paddles on, push a little hard, too hard, and then you're hurt. So it's like to your point, there's so many variables. And then I guess with open water athletes, you have them transitioning between pool and open water, and then whatever they're doing out of the water. So it could be one of a billion different things happening. But yeah, it's definitely interesting. I think I've seen with triathletes as well. I don't know if you've seen this. They'll get a shoulder injury and then they start sitting like for Ironman athletes specifically, then they'll sit in the arrow position and they'll put all their pressure on their shoulder for the hours, and they're like, well, but my shoulder's always hurting in the water. So, but you're doing all these other things that are also aggravating the shoulder and making things a little bit harder. So I think that just plays into your point of it could be many things causing the issues, not just one.
Mhm.
Um, so then moving on, like I guess like we have Beyond the Breakers coming. It's in November. You're coming for your first year. Can you give us a little bit of a teaser of, what your presentation is going to be about and what attendees should expect?
Yeah, so we're really going to think about like what what can you do in and out of the water, right? To make sure that your body is in the best position to perform, but also is to swim for life, right? Because it for the for a lot of swimmers, the performance matters, right? 100%. But a lot of people want to keep swimming for a long time and they want to keep doing these long swims for a long time. And so it's thinking, all right, what can you do in and out of the pool, right, to set yourself up for success, to stay injury free, to get rid of that nagging shoulder, right? But also to set yourself up to swim for a lifetime is what we're aiming for.
Yeah, let's think what we're all in it for. Want to have a long swim career. So I know I'm excited for this session. Is there a specific type of athlete that you're catering this talk to, or this is whether you're high school, college, adult onset, marathon swimmer, like who is your conversation or your presentation catering to the most, if anyone?
Yeah, Craig, I'm biased, but I think everyone can benefit from it. But I think if you're someone you had a nagging shoulder, right?
Mhm.
You know, maybe you've done stuff for it in the past, maybe you haven't. Maybe there's been some results, maybe you haven't, right? But it's kind of been there and you know you want to keep swimming, right? And you're not really, maybe you're not even going to stop swimming, but you know you want to keep swimming and you want to put yourself in the best position possible. I would say that is like, if that is you, it is worth your while.
I agree with you. I think everyone should be there because if they don't have an injury, they want to do the things to avoid injury in the future and keep a long career. So I very excited for it. Last two questions for you. So obviously we have a long list of speakers. Is there any one that you're most excited to listen in on, or or a speaker that you're most interested in meeting?
Um, I think I'm excited. I'm really excited to hear kind of some of the battle stories, so to speak. I think from a lot of the different speakers, and then I'm also really excited to meet and kind of see what Dan Daly presents on as someone I've gone back and forth and we've talked a couple times. And so I'm looking forward to connecting with him in real life and then also kind of seeing how our stuff complements each other and then anything on on the nutrition side as well.
Amazing.
So I
Yeah,
don't know I don't know who's doing that, but I'm very excited to learn more about the nutrition piece because I feel like that's something that I am asked about a ton. And like I can refer to a dietitian, but I don't it's something that hits home for me, but I think it would be valuable.
yeah. So yeah, Dan's amazing. We're excited to have him back. I think you'll both play off each other quite well. And then nutrition, it's Jennifer Brunelli. So
Hmm.
we're excited for her as well. So first, you're having like a nutritionist who focuses on swimming. So very, very excited for that myself. And last question. So for anyone listening, if you could give open water swimmers just one piece of advice based on your expertise, what would that be?
I think you have to think about yourself as a complete athlete. I think a lot of people just want to swim, and I think you certain times of the year you got to just swim, right? But I think trying to develop yourself as an athlete and thinking about strengthening not just the muscles for swimming, but everything, right? I think treat yourself as an athlete that is a specific specialist in open water is what I would say, and that will set you up holistically, right, for a lot of swimming to come.
Excellent advice. Definitely something we could all probably do a bit better, especially as we have life get in the way many times. So I think it's great advice, and we're looking forward to seeing you in November. So Alex, thank you so much for your time today. If you want to connect with Alex, it's l4pt.com. correct?
Yeah, the swimmingpt.com. If you're local to Maryland, l4pt.com. If you're not local to Maryland, the swimmingpt.com would be where I would go.
Perfect. Well, amazing. Thank you so much for the time and sharing your story, your expertise. We are stoked to meet you in real life, as you put it, in November,
Yeah,
on November 14th. Get your tickets from beyondthebreakers.com. And yeah, I think that wraps it for today. Thanks so much for your time, Alex. We really appreciate it.
of course, it's going to be good.